Hi, I'm Glenn Pauline, and I'll be trying the bisecting angle technique using a typodont and a snap array. So I have here a typodont, a snap array, and a size 2 very apical film. Before we start, I would like to just explain what this thing is for. This one is used to hold the film when placed inside the patient's mouth. So this one is for the occlusal part, or the posterior part of the mouth, the teeth, while this one is for the anterior part. So when placing it, you will have to keep in mind that this one will be where the patient bites, and this will be inside the patient's mouth for the lingual part. So you'll have to find where the dot is on the film, like this one, and then you will be using the snap array to clip it. So like that. You also have to lock it in order for the film to not move. So there will be a little bit of film sticking out of the snap array. So that's for the posterior part. While when doing a film radiograph or doing a radiograph on the anterior part, you'll be needing this part, in which this two fork leg will be your guide for the tooth. So placing it would be like this. The other part will be on the top, like that. You might also want to lock it in order for the snap array to not open. So let's start trying it. So for doing the bisecting angle technique using a snap array, you'll have to put the film on the snap array like this, and obviously this is for the occlusal upper jaw. So you'll be sticking it in, placing this part on the patient's occlusal surface, and then letting the patient bite so that it won't move. That. And then from here you will be adjusting the x-ray so that you'll be able to get the right radiograph. So with the bisecting angle technique, there will be an imaginary line in which I will be telling you. So on a bisecting angle technique, there will be an imaginary triangle or imaginary lines in which there will be three. So the long axis of the tooth, bisecting, and the image receptor, in which the long axis of the teeth starts from the bottom of the teeth, which is the incisal or the occlusal surface, up to its apex of the teeth, or the root, apex of the root. And the other one is the bisecting, in which it will be the incisal part or incisal edge, or the occlusal edge of the teeth up to the crown or the neck, or at least the CJ seen from the back. And the image receptor will be where you'll be placing your film. So it should be laid flat to the teeth, unlike on a paralleling technique, in which you'll be placing it away from the teeth. So since I don't have an x-ray, so I'll be just demonstrating on how you'll be placing the x-ray using this drawing. So the x-ray tube will be placed this way. you'll be following this imaginary line in which the angle of this bisecting one will also be the angle of this X-ray tube, so that when it comes to the film, you'll be getting the image of the crown up to its axis, or up to the apex of the tooth, giving you a disadvantage and advantage of using a bisecting angle technique. One of the advantages will be to be more comfortable, since the film will be just laying flat the tooth surface. And one of the disadvantages will be it will be harder for the dentist or the radiographer to position the X-ray beam, since you'll be following an imaginary line, and you have to always think about the film that you place, since they're not aligned, unlike the paralleling technique. So after the bisecting angle technique, I'll be demonstrating the paralleling technique next. So since I don't have an XCP device, I'll be using this snap array just for the placement of the film, and so that I can have the control when placed inside the patient's mouth. So I'll be putting it this way, the film, just like what I did on the bisecting angle technique. I'll be asking the patient to open their mouth wide, since I'll be placing it in the midline of their oral cavity. So I'll be putting in the film on the midline of the palatine, and the tongue will be here. So placing it above the tongue, or the dorsal part of the tongue, and between the palatine. So asking the patient when it's already placed in place, so I'll be asking the patient to close their mouth, so that I'll be able to get proper radiograph, and so that the film won't be moving. So the placement of the X-ray will be easier, because you just have to be following the long axis of the tooth. So whatever the angle, or the placement, or the angle of the long axis of the tooth, will also be the angle or the placement of the X-ray tube and the image receptor. So having that as our case, that will be an advantage for the paralleling technique, since you won't be having a hard time aligning this X-ray tube just to get the proper image of the teeth, because you just have to be following the long axis of the tooth. So, but one of the disadvantages will be it will be less comfortable, since you'll be placing the film in between the patient's mouth, touching the tongue, or the middle part of the dorsal tongue, and the palatal area. It might cause the patient to feel uncomfortable, and it might hurt their palatine, since the film will be touching their palatal area. So now a little recap between the paralleling technique and the bisecting angle technique. So when placing the X-ray tube on the paralleling technique, you just have to follow the long axis of the tooth along with the image receptor, since both of them, or the three of them, will just be placed the same. No, only the X-ray tube and image receptor, since you won't be able to move the long axis of the tooth. So they'll be just placed the same with the same angle. Unlike here on the bisecting angle technique, the X-ray tube will be following this imaginary line, while the image receptor will be placed laid flat to the patient's tooth surface lingually. So with that being said, the paralleling technique will surely be a lot easier when placing or aligning the X-ray tube rather than doing a bisecting angle technique. But it will be a lot comfortable for the patient since the film won't be touching any, or will be touching but won't be piercing any of the tissue of in the oral cavity, unlike here that it will be pushing the tongue or the dorsal part of the tongue of the patient and also the palatal area. Thank you for listening. Again, I'm Glenn Palaline from Hyge 191 and this is my presentation for doing a paralleling technique and the bisecting angle technique. Thank you.